Assalamu alaikum dear doctors. In this video I am discussing a video station. So the case or task is that Sarah, she is 7 year old. She has this kind of movement when she is sleeping. So first we notice the video, then I will discuss. First question from this video station is that what sign you are observing in the video? Answer: I saw Sarah, a 7 year old girl who looking ill with altered level of consciousness. She is having abnormal movement in a home setting, and her abnormal movement which is looks like a uprolling of the eyeball and also lip smacking. She is on recovery positions on the right side, so my differential diagnosis is this could be seizure disorder. Next question: what type of this seizure disorder? So answer is that it could be epileptic or non-epileptic. This is 6-year-old child. She probably have febrile convulsion and rule out any meningitis, any trauma or tumor or any vascular cause or any abnormal electrolytes, and hypoglycemia can cause seizure, and any drug toxicity or any drug withdrawal. This could be also be epileptic like benign Ronaldic epilepsy. So next question. So what history you will ask from the mother in this patient? The answer is I would like to ask the onset, course and durations. Any events that accompany the seizure. If there's any aura, any history of fever, any medications or she is allergic to any medication, the past medical history, birth history and like asphyxia, I would like to know that last meal to rule out the hypoglycemia. So next question is that what is the cause of the epilepsy in children? That means the differential diagnosis of epilepsy. That is epileptic syndrome like benign Ronaldic epilepsy, history of any fever and developmental regression. Then we can tell that Lennox-Gastaut syndrome, Landau-Kleffner syndrome, like any infection of the brain, meningitis, encephalitis, tumor or any trauma, any ischemia or bleeding. Rule out any hypoglycemia or electrolyte imbalance, drug toxicity. Now the next question is that suppose it is an epileptic in video, which is the name of the seizure. So associate with the history says that this happened at night when the child is sleeping, so likely to be benign Ronaldic epilepsy, and as the age is around 5 to 10 years, predominant nocturnal epilepsy affect the face and upper lip. There is some automatism like sound like drooling and twitching. Next question: what is the other name of benign Ronaldic epilepsy? The answer is benign centrotemporal spike. Now, next question: how can you investigate this child? The answer is, of course, after getting the history and focus on examination, which includes CNS examination and a complete examination of the child. I will measure the glucose level, electrolyte level, since they can be corrected. I would like to septic screen, inflammatory markers, blood culture, and plan for lumbar puncture. For a fitting child, plan for EEG, further investigation based on history. If any trauma or bleeding, we can arrange imaging of the brain after consultation with senior. So the last question, so how you will manage the child now? Answer is emergency management. It's important to about the seizure. If it's a prolonged seizure, we have to ensure airway and breathing and circulations. We have to do secondary assessment involving two examination and involving also after taking investigation we have to involve multidisciplinary team like consultant and neurologist, also if required like development specialist, involve the school social worker for the family psychologist and the ophthalmologist for the fundoscopy and eye assessment. Now next is any role of surgery or any special diet we use? Yes. So in certain intractable epilepsy we do the surgery, brain surgery. Surgical treatment is like for tumor or any hypothalamic hematoma. Next questions that the diet is, yes, special diet we use or advise that ketogenic diet after consulting with the neurologist. Now another question also can be asked that what is the composition of ketogenic diet? Now, the last question. Tell me about this patient. If he has Ronaldic epilepsy, what advice you give to the parents? So, what are the advice we give in benign Ronaldic epilepsy? These are: we have to educate the parents about management of the seizure itself, about the triggering factors, about the buccal midazolam, and also any warning sign, and we have to give action and also a lead bracelet for the patient. And also we have to refer the family for support group. Daily activity, the child avoid diving, swimming, cycling, they have to be accompanied. So when the child is swimming or cycling, there is an accompanying person present. They need advice regarding driving and advice on the safety helmet. So we hope that this question you can face in benign Ronaldic epilepsy. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.